he was hospitalized for a previous ulcer for 2 months, and he was discharged after 2 months with the same situation. Then the ulcer recurred, same situation. I mean, before 4 months, before 6 months, he had this ulcer, hospitalized, cast, bedridden for 4 months, 40, 50 days after discharge, same story, penetrating ulcer. Of course, you can see a sugar food. After 14 days of treatment with this blend of the highly specific nutritional formula plus this specific formula. Of course, we did all that should be done. We also treated him just 1 course of antibiotics instead of many courses he had before, and there is a reason for that, and I will point it out for you. Second, we lowered his blood glucose level, so we stopped the wasting of proteins, of course. This is the final story after 25 days. So we instituted the same antibiotic therapy. We improved his blood glucose level and to acceptable levels. We added a bound. We treated him with a proper diet. Our dietitian was very much involved in this. He also had 1 course of local antibiotics. Of course, you realize that this had a big impact. You can see the reasons why, you know, of course, the reasons why this is very important for discharge, for our, at least in my country, for the diagnosis-related group. For an early discharge means a greater gain, a less or a minor expense. What is the targeted nutrition we used? It's a proprietary blend of 3 key ingredients: arginine, glutamine, and HNB, what we call the specific therapy. How do they work? HNB, beta-hydroxy, beta-methylbutyrate, very difficult to pronounce. I prefer HNB. It's a natural compound in the man, produced and is a normal constituent of muscle. Those of you who are involved in sports medicine know that it's used frequently in the gym to improve the muscle, the building of muscle. A metabolite of leucine, precursor of cholesterol synthesis, so helps build up cells, reduces muscle protein catabolism, and increases protein synthesis. Also has an anti-inflammatory activity. I think this is very important because we also observed a reduction in blood glucose level irrespective of the increase of insulin. I suppose that this reduction in inflammatory state could help very much to reduce the blood glucose level. Furthermore, help the healing of the ulcer. So this is a very critical point. Glutamine, among these actions, I would like to highlight this one that could be easily overlooked. Why? Because the intestinal integrity somehow helps the immune function. You reduce the immunologic load. You help the general situation, the well-being of the subject. So second thing, very important. And for those of you who might be concerned that glutamine is a neoglycogenic precursor, I means that the kidney, most of the kidney, under certain condition, can actively transform glutamine into glucose. Well, this is the answer. First of all, this transformation is determined by the glutaminase enzyme, that is a rate-limiting enzyme, so nothing can happen more than is required. But furthermore, look at this. This is the blood glucose profile in 3 sets of subjects, 8 fat, 8 normal weight, and this is glutamine given, red line. Same effect as normal water. Same thing for in 8 obese type 2 diabetic subjects. We also, looking through the literature, found a very interesting thing. This is the concentration of GLP-1. I noticed out of the door that you use Bayera, the GLP-1 and so all these drugs. So we went through the literature, and in the American Journal of Clinical Nutrition this year, it's been published this interesting study. Same story, 8 slim, 8 non-diabetics, 8 type 2. This is the effect of GLP-1, and this is the increase of GLP-1 after glucose. This is the increase of GLP-1 after water. This is the increase of GLP-1 after glutamine. So good effect is the increase in GLP-1, and you know how many good effects this can have. The same thing we found in the literature, that the insulin under the curve under the insulin is increased in the presence of glutamine in these sets, the same set of subjects, sleep controls, obese controls, and type 2. So also increases the insulin release, maybe through the action of GLP-1. Last thing is the arginine. Arginine supports wound healing, supports protein synthesis, and also supports the immune function. This is probably the reason why we have to use just one course of antibiotics. We are accurately registering this, and if any one of you would like to do the same thing, I would be happy to discuss this. But generally you have to use less antibiotics in these subjects if you use this blend. Arginine, as you know, is produced as an internal, comes from the diet, but it's also produced from the body with the citrulline cycle. The arginine increases the secretion of growth factors, so increasing the growth of the regrowth of the cells, and helps in bacterial killing through its action of increasing nitrogen oxide, and also turns through a cycle is returned into citrulline. So, what we found in the literature also was that if you take as an example cachectic subjects, those who have a neoplastic disease, if you look at the controls, this is what happens. The rate of protein degradation in normal controls. This is what happens in the cachectic, very high increased degradation of proteins and reduced synthesis. If you take glutamine and arginine alone, doesn't work. If you add H and B alone, works a little. If you take all three of them together, you have a great result. So that the existence of the interaction of these three compounds works very, very well. This is how it interferes, increasing how the blend works, increasing the collagen synthesis. You can find it in the Annals of Surgery 2002, already many years ago. So there are many clinical studies. The efficacy and safety of the blend has been tested in many, many occasions. You can see analysis of the process. This is just a recap of what I told you before. But I would like to show you an interesting subject. This subject, she came with the same situation. This longitudinal lift, and look at this finger. When she came the first time, the finger was had this appearance, necrotic outer aspect. After we debrided her, the surgeon advised us to remove the foot, the toe. We also looked at the upper portion of the foot. There was this glass. She had something fell on her foot. She didn't even realize that. She broke the bones of the bones. However, this is the aspect after, I think, 25 days of the bound. This is the final aspect of the finger. We could say the finger. Of course, we use this on top of all the other drugs, of all the other interventions. We took care of her nutrition. We made all that was needed. But the bound definitely had a big role. And what we made recently, I can't present to you the final results because they will be presented now at the next coming conference of the EWMA in Geneva next month. However, we took 12 patients who had a previous ulcer terminated this way with a partial healing or a total healing or with surgery. Just the limb was removed. Then we confronted and we looked back at the data. We have all the data, the pictures, of course. We have a big office that takes care of the food, diabetic food, and we looked at the days needed to heal the wound or to terminate it some way with surgery or whichever else. This subject had a recurrent ulcer in the same position, or an ulcer with the same characteristics in a different position of the same foot. So we could compare exactly what happened before with what is going to happen now that we are treating them with the bound. Well, I can't give you the results because they have not yet been presented, but however, I would like to give you how to follow this story. What I can conclude for you is that a bound, the blend I'm speaking of, was made by nature and not in a chemical lab. So there is no danger in using it. And for those of you who are curious and want to know the rest of the story, this is the website, my website, where I put the results. And if you want, if I can be of help for any one of you, for any discussion, or if you want to start a discussion on the topic, this is my email. Thank you for your attention.